6 new cases of COVID-19 have been reported in Nagaland after 90 new samples were tested. The fresh cases have been detected among returnees from Chennai. All the fresh cases have been reported from Dimapur itself. Well, this takes the total number of active cases in the state to 49. Right, viewers, big story from Nagaland. 6 new cases of COVID-19 have been detected in Nagaland after 90 new samples were tested. The fresh cases have been detected among returnees from Chennai, and all the fresh cases have been reported from Dimapur. Well, this takes the total number of active cases in the state to 49. Well, earlier on May 31st, 7 positive cases were reported in the state, out of which 4 cases were detected in Kohima, whereas 3 other individuals tested positive in Dimapur. These cases were also detected among returnees from Chennai. Alright viewers, our correspondent from Nagaland, Sarah Konyak, joins me live at this point of time. Well, Sarah, 6 persons have been detected positive. For more details.
Yes, Prerna, 90 test sample results were out early this morning, out of which 6 new fresh cases have been detected, and all these 6 cases are from the Chennai returnees. All these 6 cases are from the Chennai returnees and all from Dimapur. Out of the 6, 5 are male and 1 female. So these are the 6 new fresh cases that has been detected, and currently the state tally stands at 49.
Well, Sarah, how many more samples will be tested? Any information regarding that?
Yes, Prerna, Nagaland has just one laboratory. Earlier, the sample testings were sent to the state of Manipur and Assam. But as of now, after the launching of the new biosafety laboratory, all the test samples are being conducted here in the state. And the maximum samples that can be tested in a day is 90 in the laboratory, apart from the TrueNet testing facilities. And it is also to be mentioned here, Prerna, that the state government held a cabinet meeting yesterday, headed by the chief minister, and a revised standard operating procedure has been issued, where it is clearly mentioned that apart from the here onwards, the test samples will not be just conducted in the laboratory here in the state capital, but the test samples will also be sent again back to the state of Manipur and Assam. So a lot of returnees have arrived in the state, apart from the Chennai. In the last 2 weeks, more than 6,000 returnees have entered the state. So it is becoming a very big challenge for the state government, as only maximum 90 to 95 tests are being conducted in a day. And in order to enhance more the capacity, they have decided to send the test samples to Manipur and Assam as well.
Well, Sarah, tell us about the patients. How's the situation? What about the conditions? Since we have learned that all cases are from Dimapur itself.
Yes, Prerna, we're yet to get updated on the conditions of the patients that has the fresh new 6 cases, which we will be updating later in the afternoon. However, the earlier 43 positive cases that has been detected, the condition of those patients are stable, and as per the revised standard operating procedure, it has now been decided that the Chennai returnees who have been tested negative will be sent back to their respective home districts, and also the patients who have been tested positive but are fit to travel will be sent back to their respective home districts to be treated in the COVID-19 hospitals. And those patients who have been tested positive and are not fit to travel will be kept under medication in the COVID-19 hospitals in Dimapur and Kohima. Prerna, the District Task Force Dimapur also had a meeting yesterday, and they have also emphasized on the need of having more ventilators and monitors and other equipments in the district hospital Dimapur, as a maximum of the cases that has been detected so far in the state is from Dimapur.
Well, Sarah, despite the adequate health infrastructure to deal with an outbreak like this, it's indeed for concern. So tell us, is the government all ready to tackle the situation?
Yes, Prerna, the Nagaland has remained a green zone for quite some time, and the government had almost 3 months to prepare itself. And in that, during the 3 months, 12 COVID hospitals, designated COVID hospitals, have been established. All district hospitals has been designated as COVID-19 hospitals with a bed strength of almost more than 500. And quarantine centers have also been has been set up with a bed strength of more than 11,000. And as more returnees are arriving in the state,
Right.
the government is setting up 2 more quarantine centers in Dimapur and Kohima. And with regard to the equipments, a lot of equipments were brought into the state in this past 3 months. However, like I've mentioned, the Dimapur District Task Force had also had a meeting. As maximum number of the patients are detected from Dimapur, they have emphasized on the need to have more ventilators, more monitors, and other equipments in the buffer stock.